You're lying in bed, stuffed nose, body aches, fever, and then this pounding headache hits you. And immediately your brain goes to the worst place possible. What if this isn't just the flu? What if something is seriously wrong? Now I get it. When you're already feeling miserable from the flu and a brutal headache is just sitting there, not going away, it's natural to start worrying. You Google it, and suddenly you're reading about brain tumors, aneurysms, and all kinds of terrifying things. So here's what we're going to do today. We're going to break down exactly why the flu gives you headaches in the first place, because there's actual science behind it, and more importantly, we're going to talk about the real differences between a flu headache and the kind of headache that actually deserves a trip to the ER. And a lot of what we understand today about headaches and how the brain processes pain actually builds on the work of Dr. Oliver Sacks, the legendary neurologist who spent decades studying migraines and how the nervous system creates these intense, sometimes bizarre experiences. His observations helped shape how we think about headaches to this day. Because here's the truth that most people don't know. The brain itself has no pain receptors. So if the brain can't feel pain, why does your head hurt at all? Stay with me, it's going to make a lot more sense in the next few minutes. Alright, so let's get into it. Why does the flu give you a headache in the first place? Because the virus itself isn't sitting inside your skull poking your brain. It's actually way more interesting than that. When a flu virus enters your body, your immune system goes to war. It releases a flood of inflammatory molecules, things like cytokines and prostaglandins. And these chemicals are designed to fight off the infection. The problem is, they don't just attack the virus, they cause inflammation everywhere, including the blood vessels and the meninges, those thin layers of tissue that surround your brain. Now remember what we said, the brain itself can't feel pain, but those surrounding structures, the blood vessels, the meninges, the muscles around your skull, those are loaded with pain receptors. So when inflammation hits those areas, your brain gets the signal loud and clear, pain. But that's not the only thing going on. When you have the flu, you're also dealing with fever, which dilates blood vessels and increases pressure around the brain. You're probably dehydrated because you're sweating, not drinking enough water. And on top of that, your sinuses are swollen and congested, creating direct pressure on your forehead and around your eyes. So it's not one thing causing the headache. It's a combination, inflammation, fever, dehydration, sinus pressure, all stacking on top of each other. That's why flu headaches feel so heavy and relentless. It's your entire body fighting a battle, and your head is caught in the crossfire. So now that you know why the flu causes headaches, let's talk about what it actually feels like, because this is important. Knowing the characteristics of a flu headache is what's going to help you tell it apart from something more serious later on. A flu headache is typically a dull, constant pressure. It's not sharp, it's not stabbing, it's more like someone is squeezing your head from the outside. And unlike a migraine, which usually hits one side of the head, a flu headache tends to be bilateral, meaning you feel it on both sides. Across your forehead, behind your eyes, sometimes wrapping around to the back of your head. Now here's a key detail. A flu headache never shows up alone. It always comes with friends. You'll have the body aches, the fever, the sore throat, the congestion, the fatigue. If you have all of those symptoms together and then a headache on top, that's your immune system doing its job. The headache is part of the package, not a separate problem. Another important thing, flu headaches respond to basic treatment. You take an anti-inflammatory. You hydrate, you rest, you bring the fever down, and the headache eases up. Maybe not completely, but it gets better. And once the flu starts to clear, the headache goes with it. It doesn't stick around on its own. So think of it this way. A flu headache is a passenger, not the driver. It comes because the flu brought it, and it leaves when the flu leaves. The moment a headache starts behaving differently, showing up on its own, getting worse instead of better, or doing things that don't match the flu, that's when you need to pay closer attention. And that's exactly what we're going to talk about next. Okay, so this is the chapter that really matters. Because while most headaches during the flu are completely harmless, there are certain signs that should make you stop and pay attention. Let's go through them one by one. The first and biggest red flag is sudden onset. We're talking about a headache that hits you like a switch. 0 to the worst pain of your life in seconds. That is not how flu headaches work. Flu headaches build up gradually alongside your other symptoms. A sudden explosive headache, what doctors call a thunderclap headache, can be a sign of an aneurysm rupture or bleeding in the brain. That's an emergency. Full stop. The second red flag is a headache that keeps getting worse despite treatment. With the flu, you take something for the fever, you hydrate, you rest. The headache should at least stabilize or ease up a bit. But if you're doing everything right and the headache is just climbing and climbing, getting more intense day after day, that's not following the flu script anymore. Third, neurological symptoms. If your headache comes with any of these: sudden weakness on one side of your body, difficulty speaking, confusion, blurred or double vision that doesn't go away, seizures, or a significant change in your level of consciousness, like you're becoming unusually drowsy or people can't keep you awake, those are signs that something is affecting the brain directly. The flu can make you feel awful, yes, but it shouldn't make you unable to move your arm or slur your words. Fourth, the headache outlasts the flu. Your fever is gone, your congestion cleared up, your energy is coming back, but the headache stayed. Remember what we said, the flu headache is a passenger. When the flu leaves, it should leave too. If it doesn't, that headache now needs its own explanation. And fifth, stiff neck with high fever and sensitivity to light. This combination specifically can point to meningitis, which is an infection of those very membranes we talked about earlier, the meninges. And meningitis can sometimes start with flu-like symptoms, which makes it tricky. But the neck stiffness is the telltale sign. If you can't comfortably bring your chin to your chest, that's something you need checked immediately. Now, I'm not telling you this to scare you. I'm telling you this so you know the difference between I feel terrible because I have the flu and something else is going on. Because most of the time it really is just the flu. But knowing these signs could save your life or someone else's. Alright, let's address the elephant in the room, because I know this is the real reason a lot of you clicked on this video. You've been having headaches, and somewhere in the back of your mind there's that voice saying, what if it's a tumor? So let's just talk about it openly. Here's the first thing you need to know. Brain tumors are one of the least likely causes of recurring headaches. I know that sounds surprising, but go back to what we covered at the beginning. The brain itself has no pain receptors. You could literally touch the brain during surgery, and the patient wouldn't feel a thing. So a tumor sitting in the brain tissue isn't automatically going to cause pain. It's just not how it works. Now, can a brain tumor eventually cause a headache? Yes, but here's how. A tumor causes headaches when it grows large enough to create increased pressure inside the skull. When that happens, it can stretch the dura mater, that tough outer lining around the brain, or it can press on blood vessels or compress the brainstem. And those structures do have pain receptors. But this is usually a late finding, not an early one. And it almost never shows up as the only symptom, and that's the key point. Brain tumors don't just give you headaches, they give you other things first, or at the same time. Things like seizures that come out of nowhere, persistent weakness or numbness on one side of the body, and by persistent I mean it doesn't come and go, it shows up and stays. Changes in personality or behavior that other people start noticing, vision problems that don't resolve, difficulty with balance or coordination that gets progressively worse. See the pattern? Tumor symptoms are persistent and progressive. They don't come for a few hours and then disappear. They don't respond to Advil. They don't follow the rhythm of a flu or a stressful week. They settle in and they escalate. So if your headache comes and goes, responds to rest or medication, shows up during a flu and leaves when the flu leaves, or tends to hit you during stressful periods, the chances of it being a brain tumor are extremely low. I'm not saying ignore your symptoms. I'm saying understand them, because fear comes from not knowing, and now you know what to actually look for. So at this point you might be thinking, okay, I understand the differences now, but when do I actually go see someone? Where's the line? Let me make it simple. If you have the flu and a headache that behaves like a flu headache, dull pressure, both sides, came with the fever and congestion, responds to rest and hydration, you don't need to rush to the emergency room. You need to take care of yourself, ride it out, and let your body do its job. That's it. But there are moments where you don't wait. You don't think about it, you just go. Go to the ER if you experience a sudden explosive headache, the worst of your life, that comes on in seconds. Go if your headache comes with confusion, slurred speech, weakness on one side or seizures. Go if you have a stiff neck, high fever, and can't tolerate light, the meningitis combination we talked about. And go if you're becoming increasingly drowsy or people around you are having trouble keeping you alert. Now between the ER and doing nothing, there's a middle ground. And that's scheduling a visit with your doctor or a neurologist. You should do that if your headaches are becoming more frequent over weeks or months. If they're changing in character, meaning they used to feel one way and now they feel different. If they're not responding to over-the-counter medication the way they used to. Or if you're starting to take pain medication more than 3 or 4 times a week, because as we know, that itself can create a cycle of rebound headaches that just makes everything worse. Here's what I want you to take away from this. Going to the doctor isn't about panicking. It's about being smart. Most headaches, the vast majority, are not dangerous. But your doctor can see things you can't. They can run the right tests, ask the right questions, and give you something you can't get from a YouTube video, a proper diagnosis. So don't diagnose yourself. Don't let Google be your neurologist. Use what you learned today to understand your body better, but let a professional be the one to make the call. So let's bring it all together. The flu gives you headaches, and now you know why. Your immune system floods your body with inflammatory chemicals. Your blood vessels dilate, your sinuses swell up, you're dehydrated, and all of those things hit the pain-sensitive structures around your brain. It's unpleasant, it's exhausting, but it's temporary. The headache came with the flu, and it'll leave with the flu. A brain tumor is a completely different story. It's persistent, it's progressive, it almost never shows up as just a headache, and it is far, far less common than most people think. And now you know the red flags. Sudden thunderclap headache, emergency. Neurological symptoms like weakness, seizures, confusion, emergency. Stiff neck with fever and light sensitivity, emergency. Headaches that are changing, getting worse, or not responding to anything. Time to see your doctor. That's it, that's the framework. You don't need to memorize a medical textbook. You just need to know what's expected, what's not, and when to act. I hope this took some weight off your shoulders today, because I know what it's like to be lying in bed sick, head pounding, scrolling through worst-case scenarios at 2 a.m. You deserve better than fear. You deserve information. If this helped you, share it with someone who needs to hear it. A friend, a family member, someone who always jumps to the worst conclusion when they get a headache. And if you're not subscribed yet, hit that subscribe button so you don't miss the next one. We're going to keep breaking down these topics in a way that actually makes sense. Leave a comment below if you have questions. I read all of them, and as always, this video is educational. It's not a replacement for your doctor. If something doesn't feel right, go get checked. That's never the wrong decision. Thanks for watching. Take care of yourselves. I'll see you in the next one.